This lesson is on mental disorders and resources for help. When we think about health, many people just refer to our physical health, but we do also have a mental health. Mental health is how we think, feel, and act as we cope with life. It also determines how we handle stress, which we learned in the previous lessons, and relate to others as we make choices. An estimated 1 in 4 adults over the age of 18 suffers from diagnosable mental disorder. Mental disorders is the leading cause of disabilities in the United States. Many people suffer from more than one mental disorder at a given time. This is from the National Institute of Mental Health. Adults are not the only ones who suffer from mental disorders. Many adolescents have also been diagnosed with mental disorders. There are many causes of mental disorders. Family history and genetics may play a role in development of mental disorders. If a family member has a mental disorder, then you have a higher risk of getting that mental disorder, but it doesn't mean that you will actually ever get it. You just have a higher risk of possible getting it. Life experiences such as stress, abuse, trauma may be related to the development of mental disorders. A brain injury or illness can lead to mental disorder development also. Being able to recognize signs and symptoms of different types of mental disorders is very important because we need to feel comfortable enough to ask for help when these signs and symptoms begin to be recognized. Asking for help when you recognize signs and symptoms of mental disorders is very important. It should be just as important as asking for help when you need some type of physical illness and you need help with that. So mental disorders is just as important to get the help. Treatment for mental disorders depends on how severe the mental disorder is. But most patients can see some improvement in their disorder when they just work with a team of healthcare providers. Family doctors can help direct you to the proper mental health person. Psychiatrists can diagnose and treat mental disorders. Psychotherapists are also counselors and psychologists that can help you with strategies to overcome these disorders. Pharmacists, if you are prescribed medication, the pharmacist will be your resource as for if it's the proper medication for you. Social workers teach you strategies to better deal with mental disorders, as well as teaching your family members how to deal with these disorders. When we're looking at more of a crisis type of situation, there's always a 24-hour hotline that people may call. Counseling and suicide prevention is there. Local support systems and health services within the area are available. There are a lot of times people are more in need of a face-to-face assessment in order to evaluate the severity of the mental disorder. You do not have to go to a special mental disorder psychologist or psychiatrist to be screened for a disorder. Your primary care center or your family doctor, hospitals, emergency rooms. There are some things in the community that can direct you in the right path. There are certain online type of tests and assessments that can be taken and then can direct you to the proper counselor that you may need when there are signs and symptoms of a mental disorder. Let's talk a little bit about medication. Now, when we're talking about medication for your mental disorders, it's called psychiatric medication. These are not a cure. These are just for improving the symptoms of that disorder. The cure does not come through the medication. It helps people deal with their symptoms a little bit better. Psychiatric medications help and work with other treatments, whether it's counseling or some type of psychotherapy of some type. Let's talk about some examples of medication. Antidepressants you may be familiar with. These are medications that help improve symptoms of sadness or lack of energy. It affects the chemistry of the brain. Mood stabilizing medication is usually prescribed to those who have what they call bipolar disorder. It is added to antidepressants at times if they are treating depression. Anti-anxiety medication treats symptoms of agitation or insomnia. Antipsychotic medicine is for more intense disorders like schizophrenia, although they do also use this to treat bipolar disorder also. Since we live in America, there is a pill for everything, but we would rather direct people with mental disorders to more of a psychotherapy type of atmosphere where they are being able to be taught how to deal with their feelings and their thoughts that may be contributed to the mental disorders. This psychotherapy can stem to last anywhere from a few months to possibly long term for years. It's usually done on a one-to-one basis, although they do also have group settings where there are more than 3 to 4 in a group going through the psychotherapy. For more severe cases of mental disorders, we have hospitalization that can take place. You can also have a inpatient care for like a part-time or residential program that you're living there. Some of this is included with substance abuse, those people who are addicted to drugs and alcohol, where they are given counseling and support groups all in the hospital as they are being detoxed from the medication. Although there are a lot of different treatment options for mental disorders, what we need to really be specific about is the help that is given is only for those who recognize signs and symptoms of mental disorders. Once signs and symptoms are recognized, the mental disorders can be labeled and then proper treatment can follow suit with that. It may be that you can catch it early enough where prescription medication may not be prescribed. You may only have to be taught strategies on how to deal with it in a real life situation.